for this opportunity to stand and speak to you all today. As a physician, I stand and applaud the efforts, the 52 initiatives parented by our insightful and dedicated Governor McAuliffe, his remarkable task force, and our wise legislators. These timely incentives answer our ever-growing alarm. They are gifts to our health providers, to our doctors, our nurses, our physician assistants, and pharmacists. To first, do no harm, and enhance intervention and guidance to safety, and empower us to work together as a responsible team to close those gaping avenues to opioid addiction and relapse. For the mortality of opioid addiction is as much as 30 times that of the general population. And as a Virginian, I stand in gratitude. For these bills begin to answer the humble prayers of people like me and families and friends of addicts whose lives have been devastated and cashiered by addiction. These bills are acts of love for the people of Virginia, and I'm honored to witness their birth here today. Thank you.
Good afternoon. I'm Pam Kessler, Deputy Secretary of Health and Human Resources, and it is my great pleasure and honor to introduce Governor Terry McAuliffe. Governor McAuliffe's top priority is building a new Virginia economy by creating jobs and improving the quality of life for all Virginians. I've been proud to work with him on strategies to reduce homelessness across the state, increase access to nutrition for Virginia's children, and strengthen programs addressing opioid addiction. He is committed to taking action to protect our families, businesses, and economy from these destructive drugs. It is my pleasure now to introduce the Honorable Terry McAuliffe, the 72nd Governor of the Commonwealth of Virginia.
Thank you, everybody. Good afternoon. It's nice to meet you. I've been traveling all over the state today. We've had some storms throughout the Commonwealth, I can tell you today. But I want to thank Pam and her whole team. She's right. I mean, we spend our time building that new Virginia economy. As you know, we're blessed here. I just announced a 3.8% unemployment rate the other day. It was 5.4 when I became governor. I'm very proud to say it's the steepest decline we've had in 32 years. Our economy is back. We're diversifying it, but it's not working for everybody, and that's our goal. And one of the reasons why we're here today, and as Pam mentioned, all the other efforts that we've worked on to help folks who really actually need a little extra helping hand who are in serious situations today. I want to thank the Henrico Mental Health and Development Center for hosting us. Give them a great round of applause. If you could. All the great work they do. It's good to have all our legislators here. I thank them for coming. Delegate Charnel Herring, Senator Wexton, I thank you. Delegate O'Bannon, I thank you for being with us. We are facing a big, deadly epidemic here. I can tell you, Secretary Moran, my Secretary of Public Safety, every week I get a report from all my cabinet, and in Secretary Moran's report is a list from the state police of everybody who has been injured or who has died because opiate abuse and prescription drugs. And unfortunately, every week that list is getting longer and longer. And it's really so sad to look at the list, 22 years old, 26 years old, 28 years old. It's just hard to fathom. So we know we're not different than the other 49 states. This is an epidemic that is facing every state in the United States of America. What I'm very proud is, once again, Virginia is taking the lead and doing what we need to do to go forward. As you know, last year in 2015, we had 800 fatal opiate overdoses in Virginia. That was more than died from car accidents here in the Commonwealth of Virginia. Over 800. And we're seeing more and more deaths every single week. And this number continues to trend upward. More heroin is moving into Virginia, and just as troubling, and more, as you know, fentanyl is now, which is a synthetic drug, which is even more deadly than heroin. We have now seen a gigantic upsurge here in the Commonwealth of Virginia. So we're working very hard with all of our different folks, our stakeholders, to get a handle on these issues. In 2014, as has been mentioned, I started the 2014, the Governor's Task Force on Prescription Drugs and Heroin Abuse. The goal was, we put people on this task force who really had a real understanding from the medical profession. We brought the law enforcement professionals together, and we asked them to sit around and figure out what do we do to move Virginia forward? How do we get a handle on these issues? And they came up with over 50 recommendations that they've now submitted to the governor's office, and many of these recommendations have been working with the General Assembly in a very bipartisan way. We have codified, we've now put into the Code of Virginia, signed into law. We have more to go, but we really had some great recommendations. So we're here today to sign a couple of these bills. These bills that I'm about to sign focus on prescription painkillers and how we limit and monitor the prescribing of these legal drugs that go on in the Commonwealth of Virginia. I want to thank all the legislators who are here with us today, who worked with us, as I say, in a bipartisan way. We would not be here today without their great help. Senator Wexton's bill, which I will soon sign, deals with the prescription monitoring program, which, as you know, is a critical database that we use to track prescriptions of those for highly addictive drugs. We all know what is happening there. They are doctor shopping. They're going to one doctor on one day, they're going down the street or even to a new city the next day and getting those drugs, and they're continuously moving around. Dr. Levine, it's good to see you. I want to thank our Commissioner of Health. Give her a great round of applause. And so they're getting multiple prescriptions, to feed their addiction. And Senator Wexton's bill, which will take effect in January, speeds up notification deadlines for doctors who prescribe these reporting drugs. They now, who have to do it to the PMP, right now it is 7 days, and we're going to take that actually down to 24 hours, which really, because I hate to say it, 7 days is just plain too long. People will go in 7 days and they may go see 7 different doctors, and you don't have a handle on it. So now we believe with 24 hours, we can get a good handle on what drugs are being prescribed. Her bill also lets providers and pharmacists consult with each other about patients, and it puts a copy, which is very important, of the PMP report in the patient's medical history. So now it is all right there for everybody to see. Delegate Herring, Delegate O'Bannon's bill requires doctors to check the PMP anytime they write a prescription for these painkillers that last for more than 14 days. So that is also very important for us. They must check the PMP site. The vast majority of prescribers and dispensers, let me be very clear, they are very good actors and they do great things. But we do, as you know, anything in life, there are a few bad apples, and that's what we're trying to get at. And this bill sends these reports on excessive prescribing or dispensing behavior will now be sent to our agencies for enforcement action. So, which is great, these bills have some real teeth to them. And finally, while we're not signing this particular bill today, there is one more new state law that was important that came out of our task force, one that requires continuing medical education for certain providers. We want all of our providers to know that the type of drugs that they are prescribing, what is appropriate, what isn't appropriate, because it changes. New medical data becomes available, and we want to make sure that they're up to date on the latest treatments, the rate of what they need to do on a specific type of addiction, and we want them to have the latest information and consultation so they can make the right decision. We are facing a very long fight here, as you know. Every state faces these issues, but I'm so proud to be here today with these legislators to say we're moving forward here in Virginia to do the best we can to protect our citizens. These bills represent significant steps in the battle against a real killer that we have in our Commonwealth, and I am so excited to sign these bills. And if we could, at first, if we could have Senator Wexton come up and talk about her bill a little bit, we'd appreciate it.
I think the governor has explained very well what my bill will do. I do want to take just one moment and thank the governor for creating the task force, and not just for creating a task force, but for creating this specific task force with this specific goal. I think a lot of people may not be aware that this is not the first time that a task force has taken on this job nationally or even in Virginia. But it was the first time that a task force took it on from a holistic approach. That is, from the recognition that we cannot just view this as a law enforcement problem. We can't just arrest our way out of this epidemic. And so this task force had 5 separate work groups to address every aspect of this problem. We had education, treatment, data and monitoring, storage and disposal, and enforcement. So the quality of the product that we're coming up with is much, much greater than simply something from a law enforcement perspective. And I think it's going to be much, much more effective. And so I thank all of you for being here. This is incredibly important work. It's an ongoing battle. And I thank you, Governor McAuliffe, for everything that you have done.
Good afternoon, everyone. I just want to thank you all so much for being here and showing your support. And as well, I'd like to thank Governor McAuliffe and Secretary Moran, as well as Secretary Hazel, for their leadership on this important issue. Every time I reflect back, sometimes we do, as legislators, say, why in the world did I enter this bill? Because it can be tough sometimes. But this is exactly why. When people are losing their lives and it's affecting not just only the individual, their health and losing their life, but their family. This is why, and it's such an important work. And like Senator Wexton said, this was a broad and all-encompassing approach. And it is a pleasure to work with physicians and law enforcement and other legislators when we're actually formulating policy, and it's actually good, solid policy, because it was a lot of thoughtful discussion behind each and everything. And I look forward to the continued work. This is not going away fast, but I think measured steps each time. And one of the things I look forward to working with in the future is alternatives to incarceration for those who are suffering from addiction. It's something that's been talked about nationally, and I look forward to continuing the work. So thank you so much.
Good afternoon. I've been around 15 years. Senator Wexton talked about this task force. The governor had good vision to put Brian Moran and Bill Hazel both on this task force. And it was really remarkable what we were able to accomplish. So you've heard the statistics. In my business, actually, I often wind up having to deal with this. So I just want to thank the governor and all the folks that are involved, from Raccoon County folks that are here, some folks, David Brown, who runs Health Professions, Ralph Orr, that runs the Prescription Monitoring Program. We got folks from the Hospital Association, Chris Bailey, Doug from the Health Plan. This is something we're all on the same page. And this is the first step, but we've got a lot more to do. So I thank you all for being here. I think we can actually get a lot more done.